Hey guys, Nurse Alyssa here. Today we're going to be talking about Biatain Silicone with silver. But first, if you could hit like and subscribe, it would be greatly appreciated. So let's get started. So the Biatain Silicone AG, it is a polyurethane foam dressing with a silicone border. It does have a semi-permeable top coating on the dressing, so it does reflect water and any bacteria, so it can't get into the actual dressing. The dressing does contain silver, so it is a broad spectrum antimicrobial, and it does release for up to 7 days, depending on the amount of exudate coming from the wound. It has also been shown to disrupt biofilms, and it also prevents them from starting. The dressing is designed, as all the Biatain products, it's designed to contour to the wound up to 2 centimeters, so it doesn't leave any dead space, allowing the tissue to grow upwards towards the dressing. So you would use this dressing for wounds that have signs and symptoms of localized infection, or if you suspect that they have a biofilm on the wound. It also may be used prophylactically for high-risk clients who are at risk of infection, and it can be used under compression therapy. Some precautions is you are never going to use a barrier film or spray with silicone dressings. So that's all silicone dressings in general. You do not use a barrier film. This dressing may cause discoloration to the wound bed, and you do need to remove this prior to any radiation or X-ray examinations. Some contraindications: you're not going to use this on a client who has a sensitivity or an allergy to silver products, and you're not going to use this with any oxidizing solutions such as hydrogen peroxide. Before we apply the dressing, we want to make sure that we clean the wound out very well of any debris with normal saline. So you're going to clean the actual wound and the peri-wound, and just ensure that you dry the peri-wound very well. And also, if you're going to use any creams, lotions, or anything on the peri-wound, make sure that it is completely dry and absorbed before you add the Biatain Silicone to the wound, just so it sticks, because I have found that any ointments or anything on the skin, if you don't let that absorb or dry completely, it will not stick properly. When you're selecting your Biatain Silicone with silver, you want to make sure that there is at least a 2 centimeter overlap for the dressing onto the peri-wound. You don't want it just to be right on the wound. You want it to overlap the peri-wound by at least 2 centimeters. If you're talking about a really tiny, small wound, it is okay for it just to be a 1 centimeter overlap. But in general, 2 centimeter overlap. Depending on the exudate, if you have a really dry wound, you can moisten the dressing itself with some saline, just so that the silver is activated, because how the dressings work is it's released, the silver is released when it gets moist. To remove the dressing, you're going to lift up on one of the corners and gently pull it off. If you're noticing that it is sticking to the wound base, you're going to flush it with sterile normal saline or sterile water, and it will release off. The dressing should be changed at least every 7 days, but depending on the exudate, it will have to be changed more. You can always tell when it needs to be changed when you see the exudate going towards the border. So if it's about a centimeter away from the border's edge, you're going to want to change it. The expectation of this dressing is that you do not have any signs and symptoms of infection after 2 weeks, and this is a localized infection. If somebody has a more deep spreading systematic infection, that's always antibiotics always needed for that. But if it's just a local infection and the silver is being used, you want to make sure that it's resolved within 2 weeks. If you're using it prophylactically, no infections should start. That is all I have for this video. I'll catch you next time.